I would suggest that check the scalp. Don't put it in the too hard basket. At least make an effort. Once a year I'll find a skin cancer in someone's hair that I have no idea how it exists. It makes no sense that it is there, but there it is. And I probably have to check 5,000 scalps to find that one melanoma underneath some 30-something-year-old's hair. And if we're talking time management, I have missed the opportunity to probably find 30 or 40 other melanomas by all the time I've spent looking for that scalp melanoma. But you know what the most important key performance indicator of doing a skin cancer check is? It's not how many do you find, it's how many did you miss. So you can't ever measure how many did I miss. So you have to be able to sleep at night and know you did your best. So if you're going to do your best job, I would suggest you've got to check underneath people's scalp hair. You've got to check the scalp. So I would suggest, number one, check the scalp, even though it's tedious and you might add up that time in lost opportunity to be hundreds of hours over the course of a year. You're going to find someone and save someone's life. Two, use magnification. How people find tiny basal cell skin cancers or expect to find tiny basal cell skin cancers on people's faces without at least 2 times magnification baffles me. I think you owe it to your patients to have a good look. You're unlikely to save someone's life by using magnification to find a basal cell on their face, but you'll give them a smaller scar because you'll find their skin cancer earlier. So check scalps, use magnification and good lighting. If we're going to talk about lighting, perhaps in the top 5 I'd include look at people's skin in different positions. So when someone's lying down, the way light falls on their skin is a bit different to when they're sitting up underneath halogens and downlights. So rather than looking at everything once, perhaps look at everything 1.5 times and have a bit of a glance at places you've already checked if you change the patient's posture or position during a skin check. Another tip is use your fingers. If you're going to do a skin check, part of your decision-making process is what did it feel like? There's a velvetiness to a seb-K. There's a sandpaperiness to a solar keratosis. That is valuable information which you can then tell your patients so they can find their own skin cancers. And I guess the final tip, and it often is at the end of a skin check, is don't forget to ask the patient, was there anything else you wanted me to look at? Is there anything else you thought I might be interested in? Because strangely enough, some patients think it's all a game and they don't volunteer unless they're asked what they're worried about. They're waiting to see if you find it. And I say to such patients, this isn't a game. You need to make it as easy for both of us to find whatever you're worried about as possible. And then they might be in here getting a second opinion on the sly. So you've got to make it easy for yourself and say, look, is there anything that you might have found that you're worried about? And make it part of your finishing a skin check patter. And you're hopefully not going to find too many things slip through to the keeper.